So this is a website from the Mayo Clinic on gestational diabetes. I like the Mayo Clinic website. It's very well organized, and uh, the information is very accurate. Um, Definitely worth going to on a lot of counts. So gestational diabetes is diabetes that develops during pregnancy. Uh, and it's really all about blood sugar. It's how your body uses glucose. Um, it affects the pregnancy, and it affects uh, the baby's health as well. Uh, so uh, it's controlled a lot like any diabetes with diet and exercise, um, and maybe some medication. Um, as soon as it's noted, and it's one of the things that they check for in the normal visits to the doctor when you're pregnant, it's um, it's well managed usually. Um, After you've had the baby, your blood sugars return to normal, but you might be at risk for type 2 diabetes, and that's because of downregulation of uh, the insulin receptors, because you'll have had high insulin during this gestational period, and it can lead to complications later. Come on. Okay, so just like any mild borderline diabetes, there may not be any notable signs or symptoms, or the signs and symptoms of it are lost in the signs and symptoms of pregnancy. There's a lot of physiological change happening, and you may not realize that it's not just part of uh, normal weight gain and such in pregnancy. Um, so all part of the prenatal care. They're screened and there's checkups. Uh, it occurs more often in the third trimester, uh, and it will be looked at fairly closely. If you've had gestational diabetes, it's a great idea to follow up, probably get a glucometer and follow up on a fairly regular basis, checking your sugars, uh, just to catch any complication later uh, early, because it's easier to manage then. Uh, so what causes it? They don't know. It's it might as well uh, end this course the way it began with idiopathic things. Um, so the biggest thing it looks like is that the placenta itself releases a lot of hormones. It's very endocrine, uh, and those hormones affect you as well as the baby. Uh, and a lot of those hormones is antagonistic to insulin. Um, so these insulin blocking hormones make it so that uh, you can't get the glucose into the cells, so it stays in the bloodstream. So it's a lot like type 2 diabetes in that respect. So who's at risk? People older than 25, uh, which is actually fairly young. Um, but again, 50 years ago, that would have been considered fairly late to have a baby. Uh, Family history, personal history of diabetes is more likely to develop gestational diabetes. Excess weight, uh, and there's probably a genetic basis, so it seems to have, um, there seems to be ethnic backgrounds to it. So what are the complications? This is what we really care about. So the baby's probably going to be healthy, but the baby will get a lot of sugar while it's growing, and therefore get big. It's like any other person getting a diet high in sugar. Weight gain uh, is going to be uh, significant, and can lead to complications of delivery, um, just because the baby's big. Um, Babies may be born early because of it, and like I said in the previous video, there's a real danger to premature babies of lung problems, respiratory distress. And that's because the lungs don't fully develop until right at the very end of the pregnancy. It's the last thing to develop because, really, when you think about it, the baby doesn't use lungs until after it's born. So um, they only get ready just before birth. So uh, yeah, this seems to be a problem. The baby will have produced a lot of insulin because it's used to high sugar levels. And then after birth, when the high sugar levels are removed, then they can have kind of a rebound low sugar, so hypoglycemia, shortly after birth. Uh, can can actually lead to seizures, like the blood sugars can really drop. Um, this is all preventable if they know. They basically give an IV glucose solution to the baby. Uh, they anticipate it. Because of this high insulin, and during the growth period of cells, the cells are somewhat insulin resistant. So it can lead to type 2 diabetes later in that baby's life when the baby's an adult. Higher risk of developing obesity. Again, they're pumping out a fair amount of insulin because they are somewhat insulin resistant from a developmental point of view. Uh, it is for the mother, it puts them at risk for eclampsia, preeclampsia, uh, because it could cause a high blood pressure, and future diabetes. That's the the two big things. But it's not common. Like 1 in 4 develop type 2 diabetes, especially if they exercise and reach their ideal body weight shortly after delivery. If they get back to pre-baby levels, it's much better.